Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
How you doing?
I'm good. I'm very good. We have something really exciting. This is our 70th episode. Nils told us that. So
which is huge.
Yep. We have episodes that come out twice a month on the 1st and the 15th-ish. Occasionally, we're a day late.
Never.
That's usually my fault. But we wanted to shout out to one of our recent 5-star reviews. We can't tell you how much we appreciate these. Like, it helps so much just in helping people find our podcast and also, helping our podcast show up higher in searches and all that good stuff. So this is an awesome review from Curry 2020, and it was a 5-star review. It says, the best plastic surgery podcast.
The best.
She says, I'm a new medical assistant at a plastic surgery practice. This podcast has been extremely valuable and informative in helping me learn about the terminology and procedures specific to the field. The hosts are personable and friendly, educational without being boring, and explain things in a way the average person can understand.
I think you're friendly and personable. I think I'm the educational part.
You're educational, I'm friendly.
I'm working on the personal stuff.
I don't think anyone's ever accused me of being friendly.
Really?
No.
You seem very friendly to me. We've worked together a long time.
We have.
Yeah. It's funny, our self-perceptions maybe are different than what really the reality is.
Right. I mean,
so Curie 2020, right?
Yes.
Okay. Thank you so much.
Thank you so much. So if you leave us a 5-star review,
we give you shout outs.
Yeah, you might get a shout out on our next episode.
Make you Beauty and the Surgeon famous.
That's right. I mean, it's
going across the globe. All right. So what are we talking about?
Today, we are talking about recovery, but in a different way than we've talked about before on the podcast.
Would you say it's Recovery 2.0?
I would call it Recovery 2.0.
Okay, I'm with you.
Our previous podcast was called Recovery Expectations, where we talked about specific surgeries and their
That has like a Dickens quality, like, Great Expectations, Recovery Expectations.
Yeah. Well,
this is like Recovery 2.0. It's like really getting down in there, technology.
Yes, but if you are having or are looking for information regarding recovery from a facelift, liposuction, or breast augmentation specifically, that podcast is really awesome. We go really deep into those specific kind of misconceptions about recovery from those procedures and also really specific things about those. So this is going to be more general things about recovery,
Which actually is really good because this could apply to any surgery or even to traumas, right?
Yeah, this is just recovery. I would say this is just recovery.
All right.
Yeah.
We're going to lay it out. And by the way, you're like, why is the plastic surgery podcast talking about recovery? That's a big part of what we do, is managing people after surgery, which we've talked about before, which is like controlled injury. So we are recovery experts.
We are. And
I don't want to brag.
No, perception is your reality too. So if you come away, I mean, we talk to a lot of patients here who've had surgery with other doctors for other reasons, and talking to them about how their recovery was is sometimes perplexing. Some people express having a recovery that I would say is atypical to what we experience. So then you wonder, like, was that person, I mean, I'm never going to tell someone that their recovery was not accurate. I mean, that was their experience.
That's the way they felt.
Yeah, that was their experience. So even though it's not what I would say is typical for our patients, it doesn't mean that that wasn't their experience. So, is that because of the education we give patients about recovery, or are our patients just that awesome? It's hard to say.
Yeah, I think by and large, anybody that comes to our office is awesome,
yeah.
Just so you know. So if you want to be awesome, come on in.
If you want to be a recovery superstar, Come be our patient. So there's 2 types of recovery. And this is where I love when people say, Amy, what's the downtime?
Because really, in most cases, again, if you don't know this already, this is on our YouTube channel, Jason Martin MD, so you can look at our slides. Thank you, Sarah. But in most cases, it's not the active downtime.
It's social downtime.
It's the social downtime, which is so funny. Because don't you think in your mind, you'd be like, okay, how long am I physically down for?
Well, people think that, but they also think that they're going to be bedridden after surgery.
Okay.
So once we get over the fact that you will absolutely not be bedridden for any amount of time, now what's your real question?
Right. Is when can I go outside again and see people?
When can I go out in public? When can I go to a big event? When can I have my hair dyed? Those are big questions. So we kind of call those things social downtime. So those are the visible effects of surgery. So bruising,
I don't know what the hair dyeing thing is, like a major thing.
Yes.
And if you can't hit it right on that week schedule, then it's perplexing and disconcerting for people.
Yeah, people get very aggro with me when I tell them they're not cleared to have their hair dyed like a week after a facelift.
Right.
So social downtime, again, are going to be things that are visible effects of surgery that are visible to people looking at you. So bruising, swelling, the sutures that are still in place, or, your scars while they're still really fresh and healing. So social downtime for someone who had a tummy tuck may be very short.
But signs of fact, you're walking hunched over.
Right.
And if someone asked you to say someone hit you in the stomach really hard right before you walked up.
So, or liposuction, like your social downtime may be very minimal to normal interactions, but your active downtime might be higher and vice versa. So active downtime to us are going to be things like going back to work, when you can start exercise, which is huge, when you can travel, when you can have sex again. Like those are things I consider like active downtime.
And those vary depending on the surgery or the type
Absolutely.
of injury.
Yep, so much. And
if you had an orthopedic injury, if you're watching this and you're like, okay, hopefully this gives me some information, like the orthopedic injuries and repairs will give you set standards for recovery on the active stuff. The social stuff may not be addressed, obviously, in those types of surgeries, but...
Right, if you don't care that people see that you had your knee replaced and you have a big scar down the front of your knee,
right.
wear shorts a day after your knee replacement.
You go, girl.
That's right. So, and again, that really varies. Some of these things with social downtime specifically are hard to nail to an exact date because they do vary patient to patient. How compliant you are with your post-op instructions will play into that. How likely you are to develop a deep bruise. I'm very fair. Like I bruise very easily. Other people who have darker skin or men, who are having facial surgeries, bruising may not be as much of an issue for them. If you're having surgery on your eyes, like they're going to tend to be more bruised than most other areas of your face because the skin is so thin. So, what we tend to tell people for social downtime for surgeries on the face, at least what I tell people, is if you are doing something very important, like having your picture taken for a publication, or you're going to be on television, or you're going to be at your child's wedding or graduation,
or you're a guest on the Beauty and Surgeon podcast.
Yes. Give yourself 3 months, to not only feel like, because that way you'll know that you feel like you look as good as you look.
Yeah.
You kind of lose that I look weird thing.
So with surgery or trauma, you have bruising, you have swelling, you have some cases sutures, and if you have sutures, you have scars. These things are what you want to control in the recovery time frame, and pain, which is all associated with these, is what you want to control in the recovery phase to have the shortest recovery and the best bounce back. And when we deal with patients, we look, depending on the area, we really look at those things and how we can minimize those 4 or 5 different factors in the recovery phase.
Mm-hmm. Yeah.
And by the way, pain doesn't have to be controlled by pain medication. And we're learning that now. There's an opioid crisis in the United States. It's a real problem. So we're trying to find different ways to reduce pain without having to give you narcotics.
Mm-hmm. How to manage pain. So the question always follows, sometimes right after the question is asked, sometimes the day after surgery, what can I do to recover more quickly?
First, you go to an awesome surgeon, okay? And then you have to do a lot of things as the patient to make sure you're following the instructions from your physician. And that's one of the biggest things.
It is. And that's pre and post-op instructions. So if you have pre-op instructions to not be taking aspirin or ibuprofen for 2 weeks prior to surgery and you're taking it up until the day before, well, you're probably going to bruise.
Yeah.
So following your surgeon's pre and post-op instructions about the things they want you to avoid, the things they want you to do, they're there for a reason. So they will absolutely make sure that you recover as quickly as possible. Having a good support system is absolutely key because it will make sure that you're able to follow your pre and post-op instructions. And
a good support system is not like the yes man. I hate the yes man. Oh, I don't want to do this. Oh, yeah, yes, it's no problem because I support you. That's not a support system.
Or who drugs you out of your mind.
Right. Or why don't you take another pill so you don't complain?
Let's give you some more of that
A support
Valium.
system is someone that makes you get out of bed when you don't want to. Mm-hmm. A support system is someone who tells you you can't shower with those drains in even though you want to, right? That really helps you follow the rules and assist you, obviously supportively, but not combatively, even though we've had that situation too. But just, makes you do the things you're supposed to do.
Yeah. And planning ahead, so making sure that you are planned ahead for your recovery period is going to make it much more seamless as you're going to recover more quickly. If you actually are prepared, you've got ice on hand, you're not sending your support system out to get stuff for you after the fact, after surgery has happened, like having everything ready to go.
Amy's really good at that.
Yeah. Like it'll make a big difference.
Moving plates down that you usually use so you don't have to reach up and grab them, doing things at nighttime so you don't wake up in the middle of the night and fall down. Like there's so many these little tricks that you do that can make a huge difference in recovery.
Yeah. And thinking about them ahead of time while you're clear-headed will make a big difference. One thing I always tell our breast dog patients is like the TV remote. That's one that always gets them. because you reach for it really quick
Right.
and like, oh, like you reach for it and it hurts. So put that remote really close. Like go around your house as the T-Rex and see what you can reach. Like I can't reach my cup. Like little things like that. Like
I can't do it.
right. I mean, like I could almost reach it. So those are kind of our basic things. But then that usually is followed by.
I got you, Dr. Martin, but how can I recover even more quickly?
Yeah. Like, is there some pill I can take? Can I pay more money? Can I do something?
Can I do the VIP surgery?
Yes. Like, what can I do to recover?
So I will say,
more
truthfully, that surgical technique does make a difference.
Yes.
Okay. How you treat the soft tissue, if you're a good surgeon or not, will in some ways have a big bearing on the quickness of the recovery. Yeah. But I do have patients, so I do face and neck lifts a lot. And I have some patients that heal from these and they have no bruising and swelling.
Yeah.
And then they go tell all their friends that Dr. Martin is the guy that does face and neck lifts without bruising and swelling.
And then their friend looks like they were like went 10
And their friend
rounds.
looks like, yeah,
like,
you know, it's a big pumpkin face with
Right.
bruises everywhere. They're like, what is this?
looks like they're into MMA for
Right.
4 weeks.
Bruising and swelling goes away, but definitely technique does make a difference. But there are a lot of other things you can do. We could go into all the pre and post-operative instructions, but that's really unique to the surgery, and there's thousands of surgeries or even traumatic injuries that could happen. Mm-hmm. But the things we're going to talk about now are really important for you because you can use these in your armament when you want to recover faster than average or normal.
Yes. So all of these things too, like people ask me this question, but then when I give them these answers, I get this like look of like, oh, like I don't want to do that. Like, or really I have to do that? I'm like, well, you don't have to do anything, but you know, if you want to optimize your recovery, like these are things that can absolutely help. And these are things that are proven in some ways. I mean, it's hard to prove things in alternative medicine. However, these are well-studied things that do show promise of being actually beneficial.
Right. And I don't think it's outlandish if you're going to pay the money, especially for cosmetic surgery, that you try to do some of these things to make your recovery better. Mm-hmm. But at the same time, you don't have to do it. Like I sleep with a weighted blanket. Is that absolutely necessary? No, I can still go to sleep without a weighted blanket, right? But it helps me sleep a little bit better.
Yeah, so
right?
These are like your extra credit recovery things.
Okay.
So absolutely always follow your physician's instructions. Don't do any of these things without clearing them with your doctor first. This is my
CYA legal.
Yes, my CYA. Yeah. And we do have slides for these.
This is not a medical podcast. These recommendations given on this podcast are not to be followed.
Should not be taken. Like we are not, Dr. Martin is not your physician. I'm not your nutritional therapy practitioner. Like, yeah. So if you want to see these slides, also they are up on our YouTube channel, Jason Martin MD, and also you can follow us on Instagram at Beauty and the Surgeon Podcast. So here we go. First one.
Oh, this is a photo of you. You have to look at the YouTube channel. So this is a photo of cryotherapy, and you have to look at this photo on YouTube because it's Amy in the cryotherapy tank with some strange Tron level gloves on. Mm-hmm. Is that what they put on your hands so you don't freeze?
Yeah, you have to wear gloves. So when you
do you have to do the same thing with your feet?
Yeah, cryotherapy is dry cold therapy for anyone who may not understand that. So what I'm talking about when I say cryotherapy in this modality cryotherapy can be a cold plunge. It can be a lot of things, but what we're talking about is tank, like dry cold therapy. So you're standing up in what is called a tank. It's like a big tube, and you walk in. You have nothing on except a pair of socks and a pair of gloves, unless you're a man, and then you have a little pair of shorts on, because your man parts are on the outside. My lady parts are on the inside. And yeah, you stand there.
That's a good anatomy lesson. Right? Thank you very much.
I mean, we are a medical podcast. We try.
So how cold does these cryotherapy tanks go to?
So they get to like negative 200 centigrade.
And then how long are you standing in those usually?
You work up to 3 minutes. So depending on where you start and what you're there to treat, they'll probably start you at 1.5 minutes and then work you up to 2 and then 2.5 and then 3. I'm hardcore. I'm like, just leave me in here. Like, leave me in here until I tap out. Like, yeah, I love it. And I hate being cold. But I really like it. There are definite benefits of cryotherapy. So whether you're recovering from an orthopedic procedure, which is very common. These are used a lot in sports therapy, or a cosmetic procedure, injury. They're going to be very beneficial for decreasing pain and inflammation. So specifically inflammation for joint-related injuries is really going to help decrease your pain because it improves your range of motion, gets things moving, gets blood flowing, kind of is like squeezing a sponge. If you think of your body like a sponge, that cold, it happens really fast. So you step in there and this cold air blows at you and it cools you down quickly.
And then you have this rebound vasodilatation.
Yeah. So you really feel like everything really kind of constricts in, right? All your extremities like get super, super
And then
cold,
it
super
releases,
fast.
yeah.
Yeah. So you get that like flush, and that's really great for areas that are healing, that have inflammation that's kind of stagnant in them, and helping to get that out. It also, this has been shown in clinical studies to boost mood. I can't really describe it, but it's almost like a runner's high that you get.
You get like a euphoria.
Yeah, like you get out of that tank and like you just feel good.
And especially if you're having pain and discomfort and you go in there and you feel good afterwards, even that short-term boost really helps you with recovery. FYI, recovery is a big part mental, you know, like you have to get through that stage of feeling discomfort and uncomfortable, and, you know, every time you move, it hurts. So having something like cryotherapy that decreases inflammation, decreases pain, increases flexibility and movement is huge.
Yeah. And
so where is this picture taken?
So this picture was actually taken really near our office at Cherry Creek Sport and Spine and Sport. So
shout out to Cherry Creek.
Yeah,
Spine
they're
and
really
Sport.
awesome. The guys over there are really, really good. They are both chiropractors. They do a lot of physical therapy. They have an acupuncturist there, which, I mean, it's really good. So,
Yeah. So if, by the way, I mean, you don't have to be recovering. Cryotherapy is great for people that are normally active.
Yeah, it's great for.
And I think over there they definitely have, like, you know, you can get packages, and it's reasonably priced, so you can get it on a regular basis. It's actually would be good for a maintenance.
Oh, absolutely. Again, the studies on all of these things are somewhat limited because they're testing them on humans, and human studies are inherently challenging. As we've
Unlike
talked
plastic
about
surgery,
before.
which is fully tested.
Right, fully tested. For sleep, it's really helpful for helping people sleep better. It's great for depression because it does help boost serotonin levels and mood. It just helps you feel good, which is good for a lot of things, but sleep specifically. So when I had an unlimited package, I would a lot of times go, I'd alternate. I'd go like morning one day and then night the next, because like you feel really good. It helps with recovery from workouts, but then like you sleep so soundly after a session. Like,
So how expensive would it be to get a cryo tank in my house?
it would be not that expensive probably for the tank. It's more for the liquid nitrogen, the 100-gallon, tank of liquid nitrogen that is constantly evaporating all day long.
Right. So I would spend whatever thousands of dollars on the tank and only use it a couple times.
Right. You'd have to make it worth having a cryo tank. If you're considering it, you really have to make sure you can use it, because liquid nitrogen is, even though it's in a sealed tank, it's evaporating slowly.
Gotcha.
Yeah. All
right. So we got Cherry Creek Spine and Sport. That's fine. I can go over there.
Yep.
They're great.
They're awesome.
They're great. Great crew.
So there are limitations, right? So you don't want to be in there if you have any leaking fluid, obviously, because it is very cold.
Right. So people having plastic surgery, and then they go into their plastic surgeon and say, I was listening to this podcast with Dr. Martin, and he does cryotherapy after surgery. Some of these doctors could be like, no way, because they don't understand.
Yeah.
The main part of this is, and Amy's really good at talking to patients about this, is making sure that the incisions are at least mostly healed.
Yeah, you want your sutures to be out, drains to be out.
Drains to be out.
For obvious reasons.
Nothing external. So you're talking usually about 7 to 10 days.
Yeah.
At least, at the earliest. Secondly, you don't want to severely freeze a flap of any sort until the blood supply is reestablished. So, you can't do this right away.
Yeah, it's usually about a week. Now, in a surgery, that had limited incision or limited
like
sutures.
liposuction.
Yeah, like you may be able to go in sooner, or like from an orthopedic surgery that was done with robots, like little just port therapy or port surgeries.
Scopes.
Yeah, they may let you go in sooner. And of course, they do clear you. They take your blood pressure before you go in to make sure you're not going to pass out. Your head is out, as you can see in the picture of me. Your head is exposed. There, it's a riser thing.
You kind of look like you're praying or something.
Well, I like keeping my hands
Are
out.
you really concentrating about the cold? I would be saying cuss words the whole time. I think I would.
No, you kind of have to just.
You have to be it.
You have to embrace
be the cold.
Yeah. And it's dry. I mean, that's another thing. So if you are bringing this up to your surgeon, just remind them that it is not hydrocryotherapy. Like, it's not in the water. It's dry cryotherapy. Like, you will not be submerged in water. It'll be dry. And
I would love for any listeners who have tried this just to write us and tell us their experience in talking to their surgeon about doing cryotherapy. We are definitely more forward thinking when it comes to recovery. Just be prepared.
Yeah, because we see recovery as recovery. So, yeah, cryotherapy is awesome.
We're not afraid of recovery. It's just the R word.
Yeah. All right, here's our next one. Who's that?
I know that dude.
Who's that guy?
I know that guy. So if you look on our YouTube channel again, it's a slide of me in the infrared sauna. Of course, I have my scrubs on, which you probably would not. But
no.
This was probably for an Instagram post, I'm sure.
Yes.
And I have my iPad in there, which you could definitely take into an infrared sauna because it's not moist. It's a dry heat.
Mm-hmm.
Dry heat.
Yeah.
We love infrared saunas, by the way.
Yeah, infrared sauna is different than a traditional sauna in that it uses.
We love.
It uses lower heat, so it's basically, I mean, to use an analogy more like most people understand. So it's almost, and it's not microwaving you, so don't think that it's sending microwaves through you, but it uses that same kind of idea that it's heating you more from the inside out. So rather than like blasting you with hot heat on the surface that then gets into your core, it uses a gentler heat with these, you can't see the infrared. I have the red light turned on inside there for this picture, but there is no light. Like you don't see it. Infrared is not visible to the human eye. So it is able to penetrate your tissues in a much more gentle way to penetrate more deeply with less heat. You do definitely get an amazing sweat in an infrared sauna if you're in there for long enough. You can stay in an infrared sauna. I mean, I usually let it heat up for like a half hour and then I go in there for up to an hour. By the end, it's getting, you're getting pretty hot.
So when I did it, I was so proud of myself. I stayed in there for 30 minutes and she was like, yeah, it's just now it's at the highest. Like
it hadn't even finished its preheat.
Yeah. And I was so proud when I came out. I was like, oh, that was so hard. I was at the highest heat.
Yep.
And it wasn't even at its normal heat level yet.
Well, and that's because you don't want to start off on the highest.
I know. You were like baby stepping me. That's all right. That's all right.
So
I got my IR on. I mean, maybe I didn't get the max heat.
You got to start somewhere.
You got to start somewhere.
Yeah. So in an infrared sauna, like I said, it is dry, but the main benefits are that it increases blood flow and decreases inflammation. So just like cold therapy, it's going to help get fluids moving, get blood flowing, which helps your body clear out inflammation.
Right.
Same reason why it's going to help improve mobility. It's also great for stress relief. And I put here that recovery isn't easy. And it's not. Like recovery, especially long recoveries, like it gets annoying. Like you get sick of like feeling limited. You want to work out. You want to bend over without pain. You want to, go out in public without feeling like you're bruised. Like it becomes a mental struggle. Like you said, recovery is a lot mental. So anything you can do to kind of help relieve some of that stress, but also benefit your surgical healing is going to be very beneficial.
Right.
Yeah. Just like cryotherapy, you don't want to go in an infrared sauna if you're leaking fluid. Even though you do sweat in there, you don't want to be leaking still. You don't necessarily have to have your sutures out, but for our patients, I recommend that you do. You don't want to, because you do get a little bit sweaty. You don't want to be sweating over an open wound. Yeah. So those are really, after that, the limitations, there aren't many. Like
please write into our podcast about your discussion with the surgeon you're going to go to regarding cryotherapy, then an infrared sauna. I would like to know that response.
Yeah. And infrared saunas
And to be honest with you, it would be great to combine these.
Yes.
Cold and hot therapies, post soft tissue surgeries, and that includes orthopedic surgeries or soft tissue injuries, are actually really good.
Yeah. Contrast therapy is really great. So they both have benefits.
Who's the biohacker guy that we always talk about? Ben Greenfield?
Oh, yeah, Ben Greenfield.
The one that does the cycling of the showers?
Yes, well, and he does the cold plunge.
Oh, he has a YouTube video.
Yeah.
You should watch this, where he turns the heat on and off on the shower. And when he goes to cold, you should see his face. It just looks so painful. Yeah. I don't know why you would watch that and then do it, because it does not look fun.
That's what got me to do it.
That's because you're insane.
Yeah, it is good. So infrared sauna has very few limitations. Like we would, obviously, if someone has extremely unregulated blood pressures, you wouldn't want to be in a hot and or cold environment. But if you were healthy enough for surgery, you're healthy enough for the infrared sauna. We usually start patients on a lower heat for a lower amount of time.
She starts it on the Dr. Martin level.
Right? But then you work up. So as your body gets adapted to it, you can do it more and more. You can do infrared sauna therapy multiple times a week. It is gentle, so it's not like you're going to do one session and be like, oh my gosh, all my inflammation is gone. But I can tell you from personal experience and also with patient experience, like it does make a big improvement if you stay consistent with it and actually if you do it. And you can chill in there and look at your iPad.
Yeah.
That's a good one.
Just like the photo.
Yeah.
That handsome guy.
That's a good looking guy. I know him.
I know that guy.
I know him.
Wait. There's something on his pocket. Oh, it's his name.
He's that kind of famous. He has his name on his scrubs.
It's very expensive to get that.
All right. So our next one, going down the chain of like things that people get freaked out by, acupuncture.
Oh gosh. So I'm not really a big acupuncture dude, but I feel like I should be. And there was a time when I did have back pain. This is before I lost weight and really got a lot stronger, specifically on the core. And acupuncture really did help.
Yeah.
And I mean, some of that was dry needling, but like true acupuncture, like what you would consider, really was helpful. It reduced my pain, it reduced the swelling, and it made me feel better.
Yep. Increased your mobility, like made it so you were able to move and function. Yeah. Acupuncture is great pre and post-op. So you can start doing acupuncture the day of surgery. Like you could literally go from the surgery center to the acupuncturist office and have acupuncture. Like there are...
Really?
Yeah.
Okay.
100%. It can be very helpful for people who struggle with nausea after surgery can really help with decreasing the nausea. They can even do these little, we call them seeds. So they're these little tiny stickers that have a little.
Well, I've seen those.
Yeah, used all over my ears. They can put little seeds in certain areas to help with things like nausea. They can help get your digestive function back after surgery.
Because after surgery, narcotics, the anesthetics, they all wreck your digestive system and usually cause stasis or slowing. They don't, so you feel nauseous, your food doesn't digest as well.
Yeah, so for those reasons, I mean, I think more people should be open to trying acupuncture. Now, a lot of people are just freaked out by needles. They don't think it works. Acupuncture has been around longer than Western medicine. Eastern medicine has been around for thousands of years. So there are really no contraindications for acupuncture.
Yeah, it's not going to hurt anything.
It's not going to hurt anything. It only is going to help.
Listen, this works. Okay, for someone who is not like a Eastern medicine nut, this really does work. We've had patients who we do flaps on their face. So they've had a skin cancer. The flaps get filled with inflammatory fluid.
Yeah.
They get swollen looking. You send them over for acupuncture, that goes right down. So acupuncture definitely helps with swelling for sure. And you can do that on a localized area or in a larger space.
Yeah, so it is definitely going to reduce pain and inflammation, improve digestive function, also increasing energy and mental clarity. Like that's something a lot of people struggle with after general anesthesia, is feeling very foggy.
I did.
The upside down world.
Oh my gosh.
Yeah. If you guys want to hear about Dr. Martin's experience with surgery, we had that on one of our recent episodes. When doctors need doctors. Right? When doctors need doctors. Yeah.
When experts need experts.
When experts need experts. Yeah. Same thing. Yeah. Same idea. But, it's a very common thing. People just, they feel cloudy. They feel tired.
Not right for the first 2 days.
So acupuncture can really help. It can just help your body, process through these anesthetic agents and get them out and really help you feel a lot more awake and alert. And again, there's no limitation. So you can start this right away after surgery. Finding a good acupuncturist who works with patients right after surgery is important. Like I would definitely ask your surgeon for a recommendation.
Good luck.
Or call me and I'll give you one if you live in Denver. But yeah, they use acupuncture like in Eastern medicine, like they do it as anesthesia.
We know it's Eastern medicine, Amy.
Like it's been around for hundreds of years.
It does work. Like listen, Eastern medicine works. It's been proven over thousands of years. You don't need a double-blinded study to know that acupuncture works, or we wouldn't be doing it now because people have found no benefit historically.
Right, but it still persists thousands of years later.
Right.
So really no downside.
No downside.
Yep, only positives. Acupuncture is awesome. All right.
Here we go.
So the fourth one is nutritional therapy.
Yes. So I actually think this is huge. And that's only because we've worked together for a long time now. But this is where people fall off the cliff in postoperative care, especially with surgeons, because they don't even consider nutritional therapy. Nutritional therapy and supplementation, too, is so key to recovery because surgery is an insult, just like a trauma is an insult, and you need to provide your body with the substrates to heal. Did I say that correctly?
You did, yeah, that's very true. So why is nutritional therapy going to be helpful around surgery? It's going to make sure that your tissues are optimized for healing, meaning that your cells are healthy, that your body is working, your digestive system is working prior to surgery. Like these are important things. Addressing underlying nutritional deficiencies, also very important. Like if you're going to surgery, yes, we run basic blood labs, but if you're eating a very deficient diet, you're not going to heal as well as someone who is eating a better diet.
What was that episode we did? The one that you did was postoperative nutritional. I can't forget the name of it. It was so good.
Supplementation around surgery?
Supplementation around surgery. You should definitely listen to that episode. It's one of my favorites. And we talked about that. Like everyone who wants to do liposuction wants to diet around the surgery so they can really get a good change. It's like the worst thing you could ever do.
Worst idea ever. Wants to go on the HCG diet right after and eat 500 calories a day or intermittent fast. I'm like, you are going to stress your body out. Like
no keto, none of this stuff.
Well, keto's all right as long as you're eating enough.
No, I mean, still, even with that, I don't think you get the micronutrients sometimes with keto.
If you're working with a nutritional therapist, you can do keto in a way that is fine.
Yeah.
Yeah, I wouldn't do that on your own without some support around surgery because you do need carbohydrates to heal. Like you really do. You're going to need to up your carbs around surgery. If you're doing a ketogenic diet, you need to be on a higher ketogenic diet around surgery or else you're going to feel not great for a long time.
Yeah, you feel terrible. That's why I don't understand how you could.
You could. I mean, keto, you can be in ketosis and you can be like in cyclical ketosis. So if you were wanting to do keto, you should be cycling out of keto occasionally to make sure that your metabolism doesn't become so reliant on fats for fuel that it no longer really.
But how would you get the carbs in? at the carb level you need in recovery for keto, pure keto.
Well, that's what I mean. You need to be on a cyclical keto.
Yeah, okay, that's
meaning
what I
you were
thought.
cycling.
Yeah.
So you could do 5 days keto, 2 days, on a higher carb
A
keto.
5-2.
Yeah.
We like to. You don't understand. We call it a 5-2 in the industry.
Well, they can do that for a lot of things, but also is going to help support your body's natural pro-inflammatory and anti-inflammatory processes, which are both very important after surgery, and something that specifically in our society, we tend to have a very high proportion of omega-6s in our diet and very low omega-3s. And even people who take omega-3s a lot of times are taking omega-3/6. I'm like, we have so many 6s coming at us, so those things, if your fatty acid balance is off inside your body, you're not going to have that normal inflammatory function working as it should be.
Right.
And that's going to be
And
huge.
you've showed us, especially with fats, and you've broken it down in terms of hormones, cytokines, and cytokines are extremely important in terms of recovery and healing of a wound or injury.
Yeah.
And that whole system is supported by, getting proper fat intake.
Yep. And our podcast about scars, where we talk about how scars form, is really helpful too to understand why you need the right building blocks to build your body
That's
back.
a really good point.
Your body will get by with what it has,
Right.
but it will not be ideal.
And we always use the idea of vitamin C and scurvy. And I guess that's kind of trite because really you get enough vitamin C these days.
Vitamin C is one of the ones I recommend supplementing with around surgery.
But I'm saying that if you eat reasonable amounts of good food, you're going to get some vitamin C in there, probably enough. But it's a really good indication of how nutritional intake has a definitive effect on healing.
Rickets? What's the
Vitamin D.
Yeah, what's the B12? Not peri.
Why did you say that?
It's berry.
No, berry. No, why did you do that?
Berry. It's not berry. That's the sauce.
This is killing me.
B12 deficiency.
Yeah, you.
Starts with a B.
I'm
I'll
just
think
so
of it.
not happy with you right now.
Nils is going to Google it.
Yeah, Google it up, Nils. We don't in the medical office. We don't Google.
We don't Google anything. It just eventually
Nils
comes to
Googles
us.
and then tells us. Yeah.
It just comes to us.
All right.
But so regardless of the type,
berry. It's all right. Let's keep going.
it's something with B.
Yeah.
So regardless of the type of surgery you're having,
I know niacin deficiency is pellagra.
Yeah.
Okay.
Yep. See, these are all bad things, and a good patient example of this is I was working with a woman who was getting ready to have heart surgery.
Yep.
And I looked at the list of supplements she was taking, and I said, "Does your doctor know you're taking this supplement?" And she said, "Well, I wrote it on my list of supplements." So, you need to go call the nurse at his office right now. Tell them you're taking this. Her surgery was supposed to be in 3 days. I'm like, and make sure that's okay. Because it's something I would have made her stop 2 weeks before surgery.
Right, because it maybe cause increased bleeding or bruising.
Yes.
Yep.
And when you're having something as big as open heart surgery,
Oh my God.
you kind of don't want to mess around with taking something that could increase your risk of bleeding. And people think they take a lot of supplements makes them really healthy. Like, I'm taking this pre-workout supplement. I'm taking this one to help my hormones. I'm taking, DIM. I'm taking all this other stuff. Some of those may be something you should stop around surgery. So whether or not you work with a nutritional therapist, if you are taking supplements, absolutely make sure that you go over them with someone at your doctor's office.
Huge.
Don't just write them down.
FYI, a lot of these doctors' offices won't even know what these supplements are. So you have to kind of break it down for them.
And if in doubt, just stop. If it's something that's not been prescribed to you by a medical professional, stop it at least a week before surgery. Cover your bases, just stop it. So, yay. So that's
Recovery 2.0. We said it in unison.
We did.
Yeah.
We're good like that.
Yeah.
So
that was awesome. And I do think that what we're really saying here, and this is important for anyone considering surgery, is you have to go a little bit above and beyond. You don't just have to go to a good surgeon and do the right things. Don't smoke, don't drink, follow the instructions. You need to consider some of these other treatments and therapies.
Mm-hmm. Yeah, if you want to optimize your recovery, the basics, like we covered in our first slide, what can you do to recover the best possible? Follow your doctor's instructions,
Right.
Make sure you have a good support system, and plan ahead. Now, sometimes you can't plan ahead. If you have a traumatic injury, you probably didn't plan ahead for that, but still follow your doctor's pre and post-op instructions and have some good support will really help.
And one of the best things for recovery of any kind of injury, if you're able to, is walking. Because walking stimulates your lymphatic system because it stimulates your circulation, and by association, the lymphatic system gets stimulated. That gets rid of swelling. It compresses down the veins with the muscles compress, which releases certain types of substances which inhibit the formation of blood clots. Walking is super important. Walking is also really good for your mind. We've talked about this with forest bathing. My favorite word. I just bring it up whenever I can in any conversation.
I got to forest bathing in recovery. Well, that's true.
Yeah.
Being
You can
out in
forest
nature-
bathe.
Well, and being in the sun does help with bruising too.
Sun helps with bruising. That's why you put kids under certain lights when they have the jaundice.
Yep.
When they're born.
Breaks down that excess bilirubin.
Yeah, breaks down the bilirubin. So
we know some things, Nils.
it's berry. That's what it is. B-E-R-I.
That's what I said.
It's
Berry.
berry. Yeah.
That's what I said.
It's okay, Nils.
Yeah.
That's right.
That's what I said.
You know about hibernation with
Small rodents.
small rodents.
Yes.
But you can't do Google for B12, and it's probably not even B12. That's probably the problem. It's probably like B6 or something. Anyways.
B vitamins.
So yeah, this was a really, really good episode. Enjoyable.
Yeah. Thanks everyone for listening. We appreciate your comments, ratings, and reviews, and sharing with your friends.
Shout out to Curie 2020.
Curie 2020. Yep. Thank you so much for your review. If you like this episode, please leave us a comment. Be sure to share us with your friends and follow us on YouTube at Jason Martin MD and also on Instagram at Beauty and the Surgeon Podcast. We love your questions. So if you think of any, please let us know for good topics for future episodes.
And we got some great episodes coming up.
All right. Thanks, everyone.